So as we've been saying, the virus is still out there, strong and invisible. It seems that many of us have forgotten about it. But this recent uptick in the cases has caused considerable concern. There is concern over a new variant, a new subvariant, and a lot of questions. Trust me, you need to ask these questions. Whether the existing vaccines work or not, whether you should get boosted sooner or later, whether you should get reboosted. That is also a question. And to answer all these questions, we have the World Health Organization's Chief Scientist, Soumya Swaminathan. Thank you very much. My first question, what can you tell us about this new subvariant?
Yes, thank you, Sanket. As you know, from November of 2021, we have had Omicron as the variant of concern, and we've been tracking that ever since. And thanks to a lot of real-time data that countries are uploading, we've been able to see the further evolution of Omicron. And as you know, we have a number of now sub-lineages, or you can say they are like daughter variants, which arise from the original Omicron, but have been considered as being part of the same family. And they've been given names like BA.1, BA.2, BA.3, BA.4, and BA.5, and so on. Now, when we saw the wave in India starting in December and January till February, it was mainly the BA.2 and some BA.1 that was circulating in India. And then subsequently, when we've been looking at what's happening around the world, we saw the emergence of two more sublineages, BA.4 and .5 in South Africa, but also in Portugal. And now BA.5 is a predominant variant across the world. I think it accounts for over 50% of sequences in GISAID and is the predominant one certainly in Europe. And the next is BA.4. In India, the BA.2 has further evolved. And so what we're calling now as BA 2.75 is an evolution from BA.2, and it has some interesting mutations on the spike protein. And you see what this virus is doing is it's trying to stay one step ahead of us. And every time it is evolving and changing to become a little more transmissible and also to evade our immunity, our immune responses, which most of us now have thanks to vaccination and also natural infection. So even people who were previously infected with any of the other variants, including BA.1, can still get infected with the new variant. And also what happens is over a period of 4 to 6 months, our immunity also tends to wane a little bit, at least in terms of antibodies. And so a new variant is able to infect or reinfect people because it's able to overcome the existing antibody levels. But having said all of this, what is very important to note is that the vaccines are still protecting us against severe disease.
Oh, wow.
So all of the vaccines that are being used around the world are holding up extremely well so far, despite the fact that the virus keeps trying to evade that immunity. And it's able to cause infection, but it's not able to progress to severe disease in the majority of cases. But again, having said that, we know that people are getting ill, and particularly people who have underlying conditions or risk factors. Many of them are ending up in the ICU, and unfortunately some people are still dying. I've just heard about 2 of my close colleagues, doctors, who passed away due to COVID in the last 2 days, but both had underlying conditions.
Dr. Swaminathan, while you've very elaborately answered what this new subvariant is all about, but as a layman, there is a very pointed and pertinent question, that is how devastating this variant is going to be. And I'll tell you why I ask you this question, because we saw the second wave and it was horrible, devastating. But the third wave was, for use of a better word, kinder. So how is this going to be? What's the study? What does the study say?
Yes, it's a very good question. And the reason the third wave was much kinder than the second wave was because of the vaccine coverage in the country, which was already pretty high by November. And that's an incredible accomplishment for India to have vaccinated, a large proportion of the adult population. Now, hopefully that will continue to protect us. So what we call that wall of immunity which is vaccination plus some exposure to previous infections, should continue to protect us. So I don't expect that this variant will cause a deadly wave. Certainly BA4 and 5 cases have gone up tremendously in many countries. It's not translating into ICU admissions and death. So I think the important thing to track today is what is happening in hospitals and ICUs and in terms of death reporting, and to really look at the data on the people who are dying to see who were they, what was the age group, were they vaccinated, how many doses did they have. I think data like that would be very useful for the government to make future policies, particularly on boosters. But one other point is that looking at the number of genome sequences that are being submitted from India today, the numbers have drastically gone down over the last few months. So it's very difficult to track and to understand what's going on as far as the epidemiology is concerned. So again, it would be very good if the same amount of sequencing is done in all states. Today you see data mostly coming from a handful of states. And if that continues for some more period of time, because that's how we have visibility on what this virus is doing, because at any time it could mutate into a more virulent virus. Just because it hasn't done that so far doesn't mean that the next variant could not be more deadly. So we need to keep our eyes on it.
Important point. Now, Dr. Swaminathan, though you mentioned it in your first reply that existing vaccines are holding up well, but what sort of strategy change should countries adopt, particularly India, in light of these new subvariants? I mean, we've recently changed the time period of the second dose and the booster dose, but what do you recommend?
So I mentioned earlier about the wonderful vaccination program that India carried out, and I think well over 90% of adults are vaccinated, and over 900 million Indians have received a primary course of vaccination, which is just an incredible feat to be proud of. However, when you look at the booster doses or the third dose, I think the figure is just around 45 million people or so. And even in the high-risk groups, we know that people over the age of 60, people who have underlying diseases, immunocompromised, healthcare workers, these are the risk groups. Even among those groups, the booster uptake has not been very high. And we know from experience from around the world that when it comes to Omicron and this BA2.75, you need that third dose. You need the booster dose to boost your immunity enough for the body to be able to fight this infection. And therefore, it's really important that all adults, but particularly those in the high-risk groups, should get their third dose, their booster. And this WHO advises between 4 to 6 months after the primary course. And I know that the government has now reduced the gap to 6 months from the previous 9 months. So I think it's a good time for everyone to go and get that booster dose.
Dr. Swaminathan, I've been very curious and I wanted to ask you this question. How many times should one get boosted? I'll tell you the context. Like, let me give you the example of my own parents. According to this new policy, they've already completed 6 months of their booster dose. So, what should one do? Go for a rebooster?
It's a complex question, and there is no yes or no answer. And this is something which needs to be determined, and we need more data, because obviously we don't have that long follow-up to know, at what intervals one needs to be boosted. Now, the WHO's SAGE committee looked at this question and came out with the recommendations. And basically, what they have said and what WHO recommends now is that a third dose, which is the first booster, is adequate for the majority of people to have sufficient, broad and long-lasting protection. However, we don't have data for people who have had this, more than 6 months previously. So there are data gaps, but for now it looks like it's protecting, for longer time. Who are the groups who are most at risk of dying if they catch COVID? They are again the same groups we mentioned earlier. So people over the age of, you can take 60, and then you take the immunocompromised. There are many people, who have severe diabetes, hypertension, mental health or neuro illnesses, genetic disorders, including children, by the way, fall into these groups of high risk. They are the people who could benefit from an additional booster. That is, we're now talking about a fourth dose. But there have been only few studies, only in a couple of countries. These studies did show some additional protection. But if you look at comparing primary dose, the first two doses, they give you you go from 0% immunity to 80%. Then your third dose may boost you from 80 to 85. And the fourth dose may boost that a little bit further, especially in those people in whom the antibodies have fallen, the elderly and so on. So you get those incremental advances. I don't think we are at all saying that you should keep on taking doses every few months. That's certainly not the case. But a fourth dose in some countries has been used for the people who are at highest risk. It may provide some additional benefit, but we know even after fourth dose, antibodies begin to go down after 4 to 6 months. So the longer term strategy that we are looking at is a vaccine that will be more broadly protective against all variants of SARS-CoV-2, but also against all coronaviruses, if possible. So what we call a pan-coronavirus vaccine. And there's a lot of research going on, and there are some companies who are already beginning clinical trials with such vaccines. Of course, we also have now what we call variant-adapted vaccines. Some companies are coming up with a vaccine that will have both the original ancestral strain and an Omicron, could be BA.1 or BA.4 or 5. And these may actually give an advantage to broaden the immune protection. But unfortunately, very few companies and only the mRNA vaccines are moving in that direction. So we do need more research and development in this area.
All right, Dr. Swaminathan, many thanks for joining us and sharing these thoughts. Thank you so much.